October is a very important time of year. It's Breast Cancer Awareness Month. And this month aims to raise awareness and promote screenings, cancer research, and prevention, as well as treatment of the disease. So our first guest today is Catholic Health's Director of Breast Surgery at Good Sam Hospital, Dr. Sophia Fu. Doctor, thank you so much for being with us today.
Thank you for having me.
And I'm so happy that you're here because there is such a great awareness about breast cancer, and this month has become synonymous, with that. But we always can use more information and increase our awareness. So, is there any definitive cause as to what brings about breast cancer?
Yeah, well, it's very multifactorial, so there's a lot of things that go into it. But there's some factors such as early age of first menses, maybe late age of menopause, later pregnancy, greater than 35, or no pregnancies at all. Body mass index, so obesity is really a big important factor. That's been on the rise in the country for quite some time. Smoking for sure, and then some individuals are at higher risk, where they need to be identified a little sooner.
Well, we were chatting a little bit before, and I was saying I was hearing on the radio coming in that although there might be an overall decrease in breast cancer cases, there seems to be an increase in younger women, and we were just talking a little bit about that, and you said that might be true, right?
It might be true. We are getting a lot of people getting diagnosed. I'd say in my practice, at least, there is a trend towards a little bit more of the younger patients. So I think a little bit more time will really tell, if that's truly globally or just, around here.
So that's why a greater sense of awareness, which is what you're here to talk about today too, for all people, that maybe some younger women may not even be thinking about it. But tell us a little bit about what's going on as far as helping people to become more aware.
Yeah, definitely. I think it's really important to get checked. Screening mammograms have really made a big difference over the years of detecting breast cancer super early. So the recommendations by the American Society of Breast Surgeons, which is the largest society of breast surgeons, recommends starting at age 40 for screening mammograms and really continually annually thereafter. I know there's been a lot of discrepancies with different societies, but a lot of us really hold to that. Another thing is younger women, as you were discussing, starting at the age of 25, really should come into a breast specialist to get a risk assessment to see if they are higher risk. Some individuals that are higher risk, so maybe they have a very strong family history, maybe they had prior radiation due to lymphoma, they actually have a genetic mutation that predisposes them to higher risk of breast cancer, or they have a lifetime risk of greater 20% as calculated by a risk model. Those people might need to start screening even early as 25, 30, or 35. So you wouldn't really know that if you came at age 40.
So genetics could very much be a part of all this as well? Definitely.
The majority of breast cancers, unfortunately, are sporadic. Only about maybe 15% are related to family history, and about 5 to 10% related to genetic mutation. So it's important to know about your family, because if you do identify some of these risks, you might be able to get tested to see if maybe we need to do even better for you.
Cancer is a scary word, and certainly breast cancer in itself, it means a lot to women. What are some of the misconceptions though about breast cancer, and I guess in the sense of the overwhelming fear that comes from it?
Yeah, definitely. The symptoms are one of the things that we have to discuss. A lot of people come to me thinking breast pain is related to breast cancer, but it in fact is not. There's a lot of other reasons for the breast pain, and really a very small minority of patients that have breast cancer have breast pain. It's usually much more advanced by then. You have other signs. A lot of women will feel a lump. They think automatically it's breast cancer. That's also a misconception. There are a lot of benign tumors that can happen, or even a breast cyst, which is benign. So it's really important to get it checked out if you do have something that you feel. And one of the other things I have to dispel every day is, patients coming in with a diagnosis of breast cancer, of discussing treatments. And surgery, of course, is the mainstay treatment. We have the option of either saving a breast, so partial mastectomy, or a lumpectomy versus a mastectomy. A lot of women will decide, maybe I should do a mastectomy to hopefully never deal with this again. And unfortunately, even after a mastectomy, there's still the possibility it could happen. So I don't want people to make that decision, for the wrong reason. So it's important to dispel that. But with all the great advances in adjuvant treatments and surveillance, we are doing a lot better with long-term survivorship.
And I guess there's another misconception that breast cancer is only for women. Are there not cases of breast cancer in men as well?
Yeah, that's very important to know that men can also get breast cancer. A lot of it might be due to a gene like the BRCA mutation. but some of them may not be. So it's important as a man to be aware that if there is something that they feel or something changes on their breast, that they should get it checked out.
Yeah, so it's good, that awareness, not to dismiss that it could very much be, the case. Is there a particular advice that you would give for overall breast health, and I guess overall health, but specifically as we're talking today about, about breast health?
Yeah, I always have a conversation about modifiable risk factors. I mean, there of course are things you can't control in your life, like your genes and that sort of thing. But what you can control is definitely no smoking, maybe moderating your alcohol intake 1 to 2 drinks per week. BMI, like I had talked about, is very important. You want to maintain less than 25. So you want to and to be able to do that would be exercise. There's a lot of research coming out about exercise oncology and how exercising can actually decrease one's risk or even decrease a breast cancer survivor's risk of recurrence. So it's pretty amazing. So just 30 minutes a day, 5 days a week, getting your heart rate up is great.
Well, we're glad you're here today, and we're glad to have this partnership with Catholic Health. Can you direct our viewers to good resources if they want more information or they're looking to understand a little bit more about the situation?
Yeah, definitely. The Catholic Health site has a lot of resources that's written by us breast surgeons and other specialists. Breast360.org is a great site written by American Society of Breast Surgeons, so it's very legitimate information. I always tell patients you have to just take everything with a grain of salt. Not everything is true out there. It may not apply to you, but some of the more qualified sites would be best to look at. American Cancer Society as well, and cancer.gov.
Okay. Yeah. Dr. Fu, thank you so much for being with us today. And, we want to be praying for all those who are either, in survival mode or have just recently been diagnosed. One of the great things about being this television network is that we are united with people who might be feeling alone and detached. So we're praying for all those who might be struggling with breast cancer right now. And we thank you, Dr. Fu, for helping to release some of those anxieties, right?